Hey Rob, it's Dan. Hope all is well. Thanks for the time this week. Sharing my screen, if you can forward this to your staff, that would be great. I am emailing this to you so you can simply forward it to them. This is the spreadsheet that shows the current plan from the member health plan, as well as some additional options. We want to make sure that they know that they can choose for January 1's open enrollment, which is our renewal. Couple things. If they hit file print, this is formatted to print, so it'll show up on one sheet of paper. At the bottom, you could see little footnotes about AD means after deductible, DW deductible waived. I'll make sure I go over that in the next few minutes. This is also a hyperlink, so if they click the actual plan name, it will launch a full-blown benefit summary. So while these are going to be a little bit of details, keep in mind if you're interested in a plan, click on the hyperlink and a full-blown summary will come up. Okay, so the concept of the current plan, guys, is at the bottom you can see the rates that are billed monthly to Rehab Excellence Center. At the bottom, Rehab contributes $300 a month towards the premium. So you'll have your deduction afterwards. So for example, on the current plan, there's a $291 single rate billed to the company. Since there's a $300 up to a $300 contribution, you would pay zero, and out of your check, that's monthly zero, and then per check zero. On the renewal, they raised the rate to $383. Rob and I looked at every single carrier, and unfortunately, this is the lowest costing plan in New Jersey for you guys. So we're going to renew the plan, but give you guys additional options. Some of you can keep the existing plan called the renewal. Some of you can choose proposal 1, plan Z, or you can choose plan P, proposal number 2 on my spreadsheet. The renewal is keeping the same $6,550 deductible, and then you owe nothing afterwards. But the renewal is going to $383, which would result in a $38 per paycheck deduction. That comes out of your paycheck, by the way, on a pre-tax basis. We have a Section 125 plan. So basically, as you are paying nothing to be on the plan, starting January 1, if you keep the same coverage called Plan V as in Victor, Rehab will take out $38 a paycheck to participate. Since you have to contribute, we thought you may want to consider two other plans. Plan Z as in zebra and P as in Peter. One thing neat or unique, I should say, about Plan Z is it utilizes two networks. AWH stands for Aetna Whole Health. That's your tier 1, and /2 is your open access. You guys are using the open access network right now, and I'm going to show you how to look it up, by the way. But under this unique plan, if you're using the Aetna Whole Health network of providers, you actually have a tier 1 primary care doctor copay of $30. You're no longer subject to a $6,500 deductible for everything. You don't need a referral, but you'll pay $50 to see a specialist. You have a $50 copay for urgent care. So this plan is incentivizing you to try to use the Aetna Whole Health, and it's actually lowering your hospital and surgery bill. Now, if you have bigger claims like hospitals and surgeries, radiology like an MRI, you owe $2,500 plus 20% of the bill, but you can't spend more than $6,850 for the whole year, which is really what your out-of-pocket is under your current plan. If you happen to see tier 2 doctors, which is the Aetna Select Open Access Network, you have a $6,000 deductible, you owe 50% of the bill, and you have an $8,550 calendar year worst case scenario. So what we thought that was kind of unique about this plan is at $45 a paycheck as opposed to $38, you have a fighting chance to maybe try to use a smaller network but get significantly better coverage. So that's how Plan Z works. And again, you can click on the summary. The last plan is P, which utilizes Aetna's largest network called the Aetna Choice. It gives you, for roughly the $54 a paycheck, you use the biggest network. You have an out-of-network, so you can go to doctors that don't take insurance and have coverage. You have a $50 copay. There's no tiering. You're using Aetna's largest network called the Choice POS2. You pay $50 for your primary care, that's deductible waived, $50 for specialist, $50 for urgent care. The rest of the bills, like a hospital, surgery, and MRI, you owe $5,000 plus 30%, but you never spend more than the out-of-pocket MOOP. That's $8,550 for the year. So we thought this is maybe, since you're going to have to pay towards some sort of contribution, and you see roughly I'm going to pay around $40 a paycheck, $45 or $50 a paycheck, we thought maybe you should have 3 different plans to choose from. So I hope that makes sense. I'm also showing on screen how to look up providers. You guys have the member health plan, which utilizes the Aetna network. When you go down to the employee section, it's membershealthplannj.com, by the way, and you click employee medical benefits. This portal is how you log in to see your claims, print your copy of an ID card in case you lost it. The provider search is how you look up doctors. By the way, if you click Aetna Documents, there's actually a network map to show you which hospitals take the whole health network. But there's other resources like Teledoc, telemedicine, advocates. So take a look. These are all the things you get as being an Aetna member. If you click provider search, it's going to bring you right to the Aetna website. And I'll just show you how to do this real quick. You don't have to log in and register. You can continue as a guest. So if I were to put, say, Pennsauken as my area and click search, you can select a plan, and you're going to go to the, if you're interested in that plan with the whole health network, you're going to go to the last choice right here. It says, this one that says multi-tier network. That's how you would narrow and look for Aetna providers on that plan. If you were looking at the last plan, which is the Aetna point of service 2, you would just minimize these and choose the open access, and you can see it right here called the Choice POS 2. So in other words, there's a way to narrow the network by choosing the whole health or the Choice 2, and then from here you can type the doctor's name in or use the icons at the bottom. So you're welcome to contact me. I'm going to bring up my website, ffpbenefits.com. That's my company. That's our phone number, 887-32888-5554, and that's my email, by the way. So you're welcome to reach out to me with any questions. Thanks.